Well, hello, everyone, and welcome to the Tenpenny Files. I'm your host, Dr. Sherri Tenpenny. The Tenpenny Files has daily conversations meant to inform and educate, not here to entertain. If it's matters about your body, your freedom, and your future, we talk about it here on this show. Every day, I talk with authors, documentary filmmakers, and independent thinkers whose work challenges mainstream messages. We cover a wide range of topics, so there's always something new and something different for everyone. We talk about government, politics, history, food, farming and fitness, vaccines, health and health policy, and at least once a week, we talk to authors or pastors who write about faith and biblical principles. My goal is to introduce you to topics that you've never heard of before, or topics you always wanted to have time to explore, but you didn't know where to begin. Let our guests show you the way through their work and their works of their books and their films. Join me every day, Monday through Friday at 3 p.m. Eastern at the Tenpenny Files, as we hear from voices that have been ignored, censored, or silenced, but truly have something important to say. And one thing before we start today's conversation, please become a Tenpenny Prime member. Learn more about becoming a member and all the benefits that you get. And you becoming a member supports our work. We really appreciate that. It keeps us on the air and it keeps America Out Loud going too. Go to primemembership.drtenpenny.com, primemembership.drtenpenny.com to learn more and hopefully support our work. And one last thing, welcome to all the new people who are joining us here on all the platforms where we broadcast this show. We really appreciate you being here. We hope that you'll join us every day. And for those who've become regular listeners, we really appreciate you. And thank you so much for your comments and your feedback. We're so glad that you're here. Now, let's get started. Today's conversation is with a thought leader in the field of naturopathic medicine with 32 years of clinical experience, an outspoken advocate of holistic medical therapeutics, and my friend, Dr. Peter Glidden, to talk about his book, How to Leave Big Pharma Behind and Become the Hero of Your Own Health Recovery. Peter, is so good to see you here today. Thank you for joining me on the Tenpenny Files.
Dr. STP. It's a pleasure. There's a lot of water underneath our collective bridges. I remember 20 years ago or something when we first met.
Yeah, I think so too. It was like one of those Health Freedom Expo things that they used to have.
Yeah,
Oh,
yeah.
so much fun. They were like an annual summer family reunion. That everybody that was in the health freedom sphere, they were speakers and, presenters and had products and stuff. We'd all get together in Chicago once a year, and it was just such a lovely event. I was sad to see those go away.
Yeah, people would go there for the content, but they'd stay for the community. And the community was really the big thing because those of us who've been rowing this boat forever against, the mainstream, talking about medical truths, we're very much, little islands all to our own. And when we're working and we're involved in our day-to-day life, it's relatively easy, especially back in the day before the internet was everywhere all the time, to feel isolated, you know? And
Exactly.
so those times when we would all come together once a year, it was really great because you've realized that you weren't just the only one that was thinking like this. There were lots of other people thinking like that. And I've seen that shift. That's starting to shift in our direction, but it's not fast enough for me.
Yeah, and it was always good when there were sort of new people that came that were kind of new to the sphere, and they would find that it was like a family. It really was a community. It was really, really good. So,
Yeah.
Peter, you are a doctor of naturopathic medicine.
Mhm.
People kind of throw that word around a lot, that are in our circles, but there's a lot of people and probably a lot of listeners that are listening today that don't understand the full scope of what a naturopathic medical doctor does. So why don't you tell us about that profession and about the therapeutics that you use?
Oh, okay. Very good. So, in order to become a licensed naturopathic physician in the US, you have to do 4 years of pre-med. I did that at the University of Massachusetts in Amherst. Then you have to go to fully accredited by the United States Department of Education naturopathic medical school. There are currently three in the United States, only three in the United States. It's a 4 year, 5,000 hour doctoral degree granting program. Then you have to graduate. Then you have to pass national boards. Then you have to pass state boards. Then you have to get a license to practice naturopathic medicine. And then 25 hours, believe it or not, of continuing education credit every year. So it's full-blown primary care medicine in the states in which it's licensed and regulated. And currently in 2026, it's only licensed and regulated in 24 states, plus, the District of Columbia and the Virgin Islands. So when I graduated naturopathic medical school in 1991, it was only licensed and regulated in 5 states. So we've come a long, long way, but still there's a long way to go. And let's be honest, it's a point well taken because it rings true that most people don't even know how to pronounce naturopathy, let alone know what the training of a naturopathic doctor is or what we can do. So, in a nutshell, naturopathic medicine is primary care curative medicine. So, for instance, if someone comes to me with arthritis, rheumatoid arthritis, right? It's a definitive diagnosis. We've got the lab work, we've got the x-rays, it's rheumatoid arthritis. Instead of giving them anti-inflammatories and pain meds and scheduling them for a knee replacement surgery, we would attempt to figure out why their knee became inflamed and problematic and why the body's immune system was starting to attack the knee and fix it. And we would attempt to fix it with medical nutrition, dietary change, the clinical application of water, which is called hydrotherapy, homeopathic medicine, and botanical medicine. The intention of all of those therapeutics is to support and promote the body's built-in natural ability to fix itself, and that's where the term naturopathic came from. It has nothing to do with natural medicine. That's a misconception. I don't even know what natural medicine is. I'm a big proponent of homeopathy. None of the homeopathic medicines are naturally occurring. They all had to be prepared, right? The botanical medicines that we use, we pick the plant out of the ground, but then we have to prepare it into a medicinal substance. So it's called naturopathic, not because the therapeutics that we use are natural, but because they support and promote the body's built-in God-given ability to fix itself. And that's a very important point, the God-given ability to fix itself, because our colleagues on the other side of the aisle, the MDs, who are trained in the allopathic medical model, right? And by the way, for the listening audience, nobody practices medicine. Medicine's a big umbrella underneath which many disciplines hang. There's allopathic medicine, naturopathic medicine, osteopathic medicine, homeopathic medicine, chiropractic medicine, et cetera, right? Allopathic medicine, which is the predominant medicine in the world of today, is based on Newtonian physics. It's 100% materialistic, and it argues that if it can't be measured, it doesn't exist. So, since nobody's dissected the soul out of the body or seen it with an MRI or an X-ray, it doesn't exist. Consciousness itself, to the MD, is a function of biochemistry. So when we die, it's lights out, game over. There's no such thing as God. There's no such thing as the vital force. There's no such thing as the afterlife. It's all a fiction. It's all just a fiction. Your body is a bag of biochemicals waiting to break. And so, under the tutelage and the care of an MD, nothing is ever cured, right? The diseases are managed, right? The heartburn isn't even cured. It's managed. The arthritis isn't cured. It's managed. The blood pressure isn't cured. It's managed, et cetera, et cetera. And this is the medicine that we've all gotten used to. However, there are alternatives to that which attempt to cure the condition. And the fundamental aspect of naturopathic medicine is that we are spiritual beings having a physical experience, that the human body is inhabited by a spiritual intelligence, which is running the show, by the way. I mean, our bodies are so smart, they grew themselves all by themselves from one cell into us. That's pretty good. Well, how the heck did that happen? Well, it's the intelligence of the indwelling spirit. So the naturopathic doctors argue the human body knows how to fix itself. It wants to fix itself. It's trying to fix itself all the time. And it therefore becomes the sacred, I would argue, obligation of the naturopathic physician to develop and deliver therapeutics that support and promote that. And it's the best thing since the sterile technique, honest to God, and it's the biggest kept secret in modern medicine is the naturopathic medical point of view.
Well, it was interesting to hear you say that it's now 24 states. I think when
Mhm.
I remember, and I thought it was more than three colleges. Have some of the colleges closed? And how did this progression finally move forward? Because there's this, I don't know if antagonism is the right word, or if it's controversy or competition between naturopathic physicians and people that practice naturopathy, and in terms of licensure and things like that. And so I'm really glad to hear that it's 24 states. Does and and that there's still three really professional colleges. And so over the course of the 30 years that you've been doing this, other than just the progression of licensure, what sorts of things in your profession have you seen change and grow?
Well, I have news. It's not good news.
Oh,
But the profession has changed and not for the better, in my opinion. So I'll give you again the cliff notes. So, because of lack of money at the naturopathic colleges, and the naturopathic colleges all had clinics because when you're in a naturopathic medical school, you do clinical rounds basically starting in your sophomore year. It's built into the education, so every school has its clinic, but the schools were egregiously underfunded. Always had been, at least back in the day when I was there. And what happened was that somebody at the top in who was the director of the clinic made the decision that in order to bring more revenue into the clinic, they wanted to start to treat Medicare patients, right? So, okay, so we're going to start to treat Medicare patients. And in the state of Washington, where this happened, I went to Bastyr University outside of Seattle. Um, there was a good licensure, there was good support by the government, and the insurance companies were half on board with it. So it wasn't that difficult to get Medicare to accept naturopathic treatment. However, how that panned out was that in order for Medicare payments to be accepted, naturopathic doctors had to start delivering pharmaceuticals.
mm,
So pharmaceutical education, we had a little bit of education in pharmaceuticals. That was never our strong suit. And in many states where we're licensed, we can prescribe drugs. Remember, it's not the drug, it's how it's used, right? It's not the gun, it's how it's used. Thank God for lidocaine. Every time I'm in the dentist chair, I thank God for lidocaine, right? Holy smokes. So, but when the schools started taking Medicare money, they started just going off the deep end with the standard of care allopathic pharmaceutical prescription. It was paint by the numbers. You've got pneumonia, it's a Z-Pack. You've got strep throat, it's Z-Pack, whatever, right? So they started doing that. And then they had to build more pharmaceutical education into the curriculum. And then there was a slow degradation of vitalistic naturopathic therapeutics, which led to a big division in the profession.
mm,
So right around the turn of the century, the profession became divided right down the middle. And it was so bad that naturopathic students who graduated, after the year 2000, they started showing up at Jim Sensenig's office. Jim Sensenig was the president, the first president of the American Association of Naturopathic Physicians in the 1980s. And he was a dyed-in-the-wool, authentic, real naturopathic doctor practicing vitalistic naturopathic therapeutics that supported the body's built-in God-given ability to fix itself. So graduates from the colleges of naturopathic medicine started showing up at his office because he had a reputation and said, Dr. Sensenig, we just graduated and we have no idea how to use naturopathic medicine. Will you show us how to do it? So he started to do that. And then the need grew and grew and grew so much so that a 501c3 nonprofit was formed called the Naturopathic Medicine Institute. And the naturopathic medicine, which still exists today, I I'm still an active member. I used to be a board member of the Naturopathic Medicine Institute. But the charter of the NMI is to provide naturopathic doctors with continuing education in how to practice naturopathic therapeutics, most of which tragically they just weren't taught in naturopathic medical school. And this divide was so great that to the school that I went to, the College of Naturopathic Medicine, Bastyr University, excuse me, just last year went bankrupt.
Oh, no.
Yeah, they went bankrupt because they were teaching such ridiculous, watered down, middle of the road. We called it collectively green allopathic medicine, that the students who graduated couldn't get a job. They had no idea what to do, really. And so it became a problem and still is a problem. The profession still remains divided. But, the Naturopathic Medicine Institute is keeping the flame of vitalistic medicine alive. And it's the type of a situation where, you can't, the only reason, honest to God, that this profession still exists is because we have our fingers on a truth, right? Once you've experienced the truth, you're in its velvet grasp forever. It's never going to go away. I mean, if an asteroid hits tomorrow and humanity disappears and then humanity starts to come back in base 10 mathematics, 2 plus 2 will still equal 4. And in, Euclidean geometry, a squared plus b squared is still going to equal c squared. These are truths that never go away. They have to be discovered. And that's what naturopathic medicine is. Naturopathic medicine is based upon natural law, which is inviolate. And that's interesting because in naturopathic medicine, real naturopathic medicine, we never discard anything. We add because we learn new things, but we never get rid of old therapeutics because the old therapeutics were built on natural law. And that's just the thing, whether you believe in it or not. And, this is juxtaposed against the allopathic method. And for goodness sakes, the halls of allopathic medicine are littered with the discarded remains of therapeutics, which in their day were the standard of care. And we look back at them and now and we go, oh my God, you've got to be kidding me. How could they possibly have done that? So it's an interesting time to be a naturopath. And you bring up a good point because there are two separate groups of people in the world today who are calling themselves naturopaths. There are the naturopathic physicians who did 8 years of medical school and all the licensing, right? And then there are people who have gone to non-accredited, not really academic institutions who deliver, they're like diploma mills and they deliver training in naturopathic medicine. Now, as fate would have it, irony of ironies, the people in those schools are more grounded in real naturopathic therapeutics than the people who went to the naturopathic medical schools. I mean, that's how far the schism has gone.
Wow. So,
It,
Peter,
it, it doesn't bode well for the profession, but time will tell.
what if Bastyr went bankrupt? I mean, that's always been sort of the stalwart of naturopathic education. What
Yeah.
th what three schools are left?
Well, so Bastyr is coming back. Bastyr, they had a big campus outside of Seattle, a lot of acreage, and they had dormitories and they had a lot of real estate. And I think they sold some of it off. They got rid of the people in charge who were running it, and they brought back Joe Pizzorno, Dr. Joe Pizzorno, who was the founder of naturopathic of Bastyr University when I went there, to kind of revitalize the education at Bastyr University. And that just happened like 6 months ago.
Wow.
So Bastyr is trying to bounce back, and we'll see what happens. I have a colleague in Montreal who was trying to start a school of naturopathic medicine. You wanted it to be an authentic school of naturopathic medicine with a heavy leaning towards homeopathy and hydrotherapy. But legally, they couldn't do it because the laws, are stacked against us. And this is a big deal that a lot of people are unaware of, right? We haven't had medical freedom in this country since the early 1900s. When the Carnegies and the Rockefellers colluded, they glad-handed politicians and convinced the American medical or convinced Congress to make the American Medical Association the sole arbiters of medicine. And it was the AMA who got to decide which doctors could practice and which doctors couldn't. It was a hostile takeover. of the medical marketplace. And it happened so long ago that most people don't even know that it happened. And there's a medical monopoly that's existed now for over 100 years, and most people are completely unaware of it. And I would argue that the medical monopoly is, in fact, the cause of the chronic disease epidemic because the medical monopoly only allows for one type of medicine. It's the MD, allopathic, materialistic, reductionistic system of medicine, which is fantastic, by the way, for trauma care, surgery when it's necessary, military field medicine. That's the wheelhouse of materialistic, reductionistic, allopathic medicine. They do that stuff really well. But for most of the conditions that most people go to the doctor for most of the time, it's absolutely positively the wrong method because they don't know what causes the disease. They have no idea what to do to cure the disease. They don't even think a cure is possible unless in the off chance you throw an antibiotic at somebody and the strep throat goes away. And while you're under their care, the illness is managed. Nothing's ever cured. Then you need more drugs. Then there's more side effects. And then you need more drugs. And then there's more side effects. And then you go bankrupt. And then you die. And let's not forget the leading cause of bankruptcy in the US is medical bills. And depending on how you crunch the numbers, the first or the third leading cause of death is MD-directed medical therapeutics. You could only get away with shenanigans like this inside of a monopoly. And that's the reason that your profession and my profession and the chiropractors and the homeopaths and everybody else are beneath the wheel. It's not because our therapeutics aren't better. It's not because our therapeutics aren't, less expensive. It's because of the medical monopoly, which keeps everybody who's not an MD off the bus of medicine. And it's a crying shame. People are suffering needlessly. And this is what Bobby Kennedy needs to hear. I mean, thank God, cleaning up red dye number 7 or whatever the hell it is from school lunches, but that's not going to fix the problem. We need medical freedom. We need all types of medicine: homeopathic, naturopathic, osteopathic, allopathic, chiropractic, Ayurvedic, hands-on healing, botanical medicine. They all need equal protection under the law. They all need equal amounts of insurance coverage. They all need to be allowed hospital privileges, and universities need to be encouraged to do research on all of it. And if we could do that, then humanity has a chance. But until that happens, we're spitting into the wind as far as I'm concerned.
Well, we should say Dr. Peter Glidden for president.
Yeah, well, I don't know. I don't
Absolutely.
know, man.
It's absolutely true what you just said. And whatever happened to the Institute for Integrative Medicine under the arm of the NIH? You never hear about that anymore. And what
No,
was about that
yeah,
was when that got it for the audience when that got implemented, 15, 20 years ago now. Everybody was so excited about it, except at that time, the NIH had something like a $1 billion a year budget, and
yeah.
and the Institute of Integrative and Alternative Medicine was allocated $1 million a year for their budget. It was like, barely enough to make payroll and rent, so I think we got a lot more to talk about here today, but I think this is a good place to take a short break to hear from our sponsors for AmericaOutloud.news. America Out Loud Talk Radio plays the Tenpenny Files on the iHeartRadio network every day, Monday through Friday at 3 p.m. Eastern. You can also listen to us anywhere from going to their media player on AmericaOutloud.news and listen through their media player that plays all over the world. If you've missed any of these great conversations that we've been having since I started on this platform, then there have been some really fantastic interviews and conversations. You can find the Tenpenny Files if you go to Spotify, Pandora, Apple, iTunes, TuneIn, iHeart Virtual Studio, and any of my platforms, which I think is the best place to find our podcasts. If you go to drtenpenny.com and you just hover over the podcast tab, you will see a drop down window. And about halfway down on that drop down window, it will say all podcasts. Can't be any easier than that. And you can click on that and you can scroll down. You can read about the guests that we've had and you can see all the different guests we've had 5 days a week. That's the best place. We also live stream these to Instagram, X, Rumble, and my Substack. And now we actually started a YouTube channel. We'll see how long the powers that be let me stay up there, because every time I've tried to start one, they've shut me down. But because there's so many great books and so many great conversations to have, we're meant to maximize your time, and hopefully you will support the authors and their work. We've got more to come on this show today with our great conversation with my dear friend, Dr. Peter Glidden, about his book that we have to get to yet. We've just been talking about naturopathy here, about his book, How to Leave Big Pharma Behind, which is something that everyone listening to this wants to hear about. Hold tight. We are going to take a short break. Please listen closely. We will be right back. Zeolite is a detox spray. We work specifically with a company called Touchstone Essentials. They are an incredible company. We've been working with them now for several years. And zeolite is a mineral that goes through your body like a one-way basket. It will clean out heavy metals such as arsenic and mercury, aluminum, cadmium, and it hooks onto those metals from a one-way perspective. So once it's bound, it goes out through your urine or your stools and doesn't get redeposited in other places. Everybody needs to have a detox product in their life, and this one is so easy to use and it's so safe. You can take it when you're pregnant, you can take it when you're nursing, you can give it to little children, you can even give it to infants, and quite frankly, I give it to my dog. I actually put a little bit of the zeolite in his water because until we all stop living in a toxic world, we all need to get some of those extra toxicities out, the heavy metals, the persistent organic pollutants, the things that are floating through the air, the different things that we come in touch with in our environment. And we are a big fan of zeolite from Touchstone Essentials. We've been a big fan of their products for several years. Go to drtenpenny.com/detox to get your first bottle of zeolite spray for $50 off.
Well, only when the government bows to the people will America become great again. This is Malcolm Out Loud here. Join me in pushing back against censorship, my fellow Americans. Right at the top of AmericaOutloud.news are the words: many voices, one freedom, united in the First Amendment. Now is our time, my fellow Americans. AmericaOutloud.news, liberty and justice for all.
Well, welcome back, everybody. Today's conversation is with outspoken advocate of holistic and natural medicine, my dear friend, Dr. Peter Glidden, to talk about his book, How to Leave Big Pharma Behind and Become the Hero of Your Own Health Recovery. Let me tell you just a little bit more about our guest today. Dr. Peter Glidden is a licensed naturopathic physician with more than 30 years of experience to help people recover with their health without the use of pharmaceutical drugs or surgery, except if they get run over by a bus. A leader in the field of naturopathic medicine and an outspoken advocate for holistic health therapeutics, Dr. Glidden brings years of experience as a licensed naturopathic doctor to all of his public presentations, online information, podcasts, and private consultations. Peter, welcome so much back to the show. It's so good to see you again.
Yeah.
We get together more often, but we do it as often as we can.
Yeah. It's good to see you. Honestly, we're very much like sons and daughters of different mothers, right?
So tell us a little bit about, let's dig into, because the book that you wrote, it's actually a trilogy and it's long and there's a lot of information packed in there. In your book, How to Leave Big Pharma Behind. That's what we all want to do. So why don't we start by, how did you start writing it? I imagine it's a compilation over many years of your life and your work and your experience. But tell us a
Yeah.
little bit about this book.
Yeah, it took me 67 years to write the book. Really, because it is the culmination of your life's work, right? 37 years now, I think, of clinical work. So there's a couple things that I have discovered as I've gone down the road of naturopathic medicine. First thing, when you look at the Latin word for doctor is docere, it means teacher. And I always saw myself as a teacher, especially in this day and age when, we exist inside of a medical monopoly. Very few people understand anything about medicine. They only know what they've been spoon-fed in school, most of which is a lie. Don't even get me started about vaccines. It's all a lie. Nobody knows that better than you. But so I figured out right from out of the gate that people needed to know what naturopathic doctors knew. And I have a robust private practice, but I don't want to give somebody a fish, man. I want to teach them how to fish. And I've had a couple of revelations in my very humbling revelations in my clinical work. So I was working with a pretty famous naturopathic doctor years ago. His name was Joel Wallach, and Dr. Wallach was in charge of a $25 million, 10-year-long research program. Wallach did 10,000 autopsies, millions of blood chemistries and histopathologies, and discovered a number of very compelling things about medical nutrition. And by the way, Wallach's research is in the Smithsonian Institution. It's considered a national treasure.
Is that right? Wow.
I learned so much from Dr. Wallach, it's not even funny. So I'm at a lecture that Dr. Wallach was giving in Illinois somewhere, and it was a blue collar community. It's myself and Dr. Wallach and maybe 35 other people in the room, and they were all blue collar people. I doubt anybody in the room except me and Dr. Wallach had more than a high school education. And one by one, these people would stand up and give a testimonial about how they had recovered from these really serious illnesses, like migraine headaches, infertility, rheumatoid arthritis, chronic pneumonia, all this stuff. And they didn't do it with a private appointment. They did it by learning what to do to support and promote your body's built-in God-given ability to fix itself, which was based or kind of filtered through the lens of Dr. Wallach's research. So Wallach's research discovered some really interesting fundamental principles here, that there are 90 essential nutrients that the human body needs in order to function the way that God and nature intended it. 60 minerals, 16 vitamins, 12 amino acids, and 2 fatty acids. These are essential nutrients, which means the body needs them, but it can't make them. So they have to find their way into the body somehow, and that's through the food. But the problem is that for the last, 100 years, the concentration of essential nutrients in our foods has gotten less and 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 less. So here's how many essential nutrients everybody's body needs. Here's how many is in the food that they eat, less than half. And then the stress of life comes rolling into town, burns through the reserves, and then things start to break. Then they go to a medical doctor because that's the only thing their insurance will pay for. That's the only thing that the law allows for. The medical doctor has no idea what caused the problem. All they do is throw a drug at the problem. The drug doesn't fix the problem. It mitigates it. It manages it. And then it's a slow slide into bankruptcy and death. So all these people are standing up and they're giving and my head exploded because I'm thinking, you need to go see the doctor, right? You need a private appointment. You need a private appointment. And guess what? You don't need a private appointment. Sometimes you do. And I crunched the numbers. I've looked at 10,000 people, followed 10,000 people over the last 9 years who've done the generic protocols that are in my book and on my website, and 83% of them recovered their health without the need of a private appointment. Yeah, I'm talking about serious illnesses, right? You would believe it, but most people wouldn't believe the things I've seen people recover from. And let me make one thing clear. This is not the secret decoder ring to all things medical, and we don't have the answer to all human ills. We don't. But we have really sound therapeutics based upon natural law, which are extremely effective, and which, if you're smart enough to pass the driver's license test, you're smart enough to learn how to do it. And so that's why I wrote the book. In order to teach people what to do to stimulate their body's built-in God-given ability to fix itself, because it's not that difficult. Look, surgery is complicated. I don't recommend that if, your son needs their appendix removed, that you go to Google and take an at-home surgery course and order a bunch of scalpels and do it yourself. You don't do that. But for most of the things that most people go to the doctor for, most of the time, there are strategies which have been developed by licensed physicians and proven to be effective clinically. And you can apply them from the comfort of your own home. So that's why I wrote the book, in order to enlighten people about all that.
Peter, I had a conversation with Dr. O, who's a animal chiropractor, and he was talking chiropractic, with your pets, and his favorite animal to adjust is a professional bucking bull. That's his favorite
Wow.
animal to adjust. But he's talking
Wow.
about, we were mostly talking about, our dogs and our cats and our, animals at home. And he said, it's these animals intrinsically know what to do to make themselves better. If they're not feeling well, they know what to eat, and they know what to drink, and they know when to lay down, they know when to exercise. And we're mammals, and intrinsically we should have that same ability if we just paid attention and knew just a little bit about basic nutrition. You
Yeah,
know,
and it's interesting that you should mention that because before Dr. Wallach, who was at least in my life, opened these doors for me, right, and showed me the possibilities. Before he became a naturopath, he was the world famous veterinarian pathologist. That's why he was tapped on the shoulder to do this 10-year research project because of the work that he'd done with animal pathology, with epidemic diseases and other things. So, and Wallach's research with the nutrients doubled the life expectancy of the average household dog. Because before, and irony of ironies, and here's something to think about. Most people's pets are better nutrified than their owner is. I mean, just read the label on the pet food. It's loaded with vitamins and minerals and amino acids and fatty acids, and it's fantastic. But the food that we eat isn't. And this is why we have a chronic disease epidemic, because the fundamental aspects of human health are not taught to the medical doctors. They're not. They're good at surgery and trauma care, right? That was your thing. You were an ER supervisor in ER forever, right? And that's the wheelhouse. But for goodness sakes, for everything else, it's a crap show. So the book was intended, it was in three parts. Yeah, the first part is to kind of break the history of the evolution of medicine in the United States down and teach people about the monopoly, because they need to understand that, right? They need to understand that the monopoly exists. When you understand that the monopoly exists, everything else falls into place. And then part two was to teach them about the foundation philosophy and concepts of the holistic method, the naturopathic medicine, that the body, we're spiritual beings having physical experience, that the body has innate spiritual intelligence, that the body knows how to fix itself and wants to fix itself. And there are all these therapeutics that have been developed over thousands of years that recognize and support that. Well, that's an eye-opener for most people. And then the third part of the book is the therapeutics. You've got asthma. Okay, do this for 90 days and see if it works. And 83% of the time it does. So that's why I put the book together, because honest to God, Sherri, and you know this better than anybody, people are suffering needlessly.
it's true.
Needlessly. My people are destroyed by lack of knowledge.
Mhm.
And the main reason that there's lack of knowledge is the medical monopoly, which has existed for so long that nobody even recognizes it as a monopoly. And it's literally killing people. And we need to get out from underneath it ASAP.
In a perfect world, Peter, with all that you know, because you're brilliant and you really articulate it well, you write well, your presentations are both very informative and funny because you're really entertaining too. So, and the best way to get information through to people is with humor a lot of times.
Yeah.
You're just kind of like all of this in a perfect world. And you talk about, what we need to get to Bobby. And, I would say that Bobby knows all this stuff, that what we need for Secretary Kennedy is for somebody up there on the Hill to take the straitjacket off of him and let him do his job, because
Yeah, I would agree.
stuff that he's trying to do. He's doing low-hanging fruit right now, red dye
Yeah.
and microplastics and stuff like that. He's not he's tied up in a straitjacket, because he knows all this stuff. He's known it for 40 years. But in a perfect world, if you were in a place of real authority to make a difference, how would you see medicine delivered in the US?
Well, Benjamin Rush, Dr. Benjamin Rush, one of the signers of the Declaration of Independence, said it better than I did. And I'm paraphrasing. Here's what he said over 200 years ago. Unless we put medical freedom into the Constitution, the time will come when medicine will organize itself into a dictatorship, restricting the art of healing to one class of doctors and denying equal privileges to others. This will constitute the Bastille of medical science. All such laws are un-American and despotic. And that's exactly what happened here. So the Zen sword that cuts through all of this and that brings things to parity is medical freedom. We need to convene a convention, a constitutional Congress, and put medical freedom into the Constitution that gives all systems of medicine equal access, equal protection under the law, equal insurance privileges, equal hospital admittance ability. Universities need to be encouraged and rewarded for doing research on alternative to MD medicine therapeutics. And if that were to happen, it would only be a matter of time before a couple of very wealthy people, like Saudi Arabian prince wealthy people, their family members were cured of something that the MDs couldn't cure. And then they would give billions of dollars to found homeopathic hospitals, chiropractic hospitals. There used to be chiropractic hospitals in this country until the mid 70s when Medicare stopped, then insurance companies stopped paying for it. Before the Flexner report, when the hostile takeover of medicine happened, the medical monopoly happened in the early 1900s, there were over 100 homeopathic hospitals all throughout the U.S. The busiest medical clinic in the United States, west of the Mississippi, before the medical monopoly took over, was a naturopathic clinic in Spokane, Washington. It was run by a naturopath called O.G. Carroll. And mostly what O.G. Carroll would do with his patients was hydrotherapy and diet, hydrotherapy and diet, hydrotherapy and diet. And he was curing people left, right, and center. It was the busiest clinic west of the Mississippi. Why? Because it worked. And this is what I've always said, man. If by some genie in the bottle magic, we all woke up tomorrow and there were just as many naturopaths and homeopaths and chiropractors and osteopaths and Ayurvedic practitioners as MDs, insurance paid for everything. And there were, just as many homeopathic and naturopathic hospitals as there are MD hospitals in 1 year, MDs will be out of a job. Because in a free market, people gravitate towards what works. And the holistic medical therapeutics are curative. They attempt to cure the condition. We're not always successful, but at least we attempt to cure the condition, which is anathema to allopathic medicine. So in a perfect world, I would legislate heavily for medical freedom, and I would encourage people with very deep pockets to fund naturopathic and homeopathic hospitals, chiropractic hospitals where real curative medicine was applied.
I don't read it every single day because they're usually pretty long. So sometimes it's based on time. But I subscribe to Jeff Childers' daily Substack. It's COVID and Coffee because he's a lawyer and he writes great stuff and he's funny. And so literally, I've been on airplanes sometimes reading his Substack from my phone. And I find myself I'm laughing out loud in the middle of an airplane. So good. And he put out a Substack a couple of days ago. It was like a health update, and he was talking about the use of AI and forward-thinking technologies and how it's going to just put everything out of business, including the pharmaceutical industry. And he told a story in his newsletter about a guy who had a dog that was a rescue dog and was also like a personal care dog. And the dog was diagnosed with a very aggressive type of non-treatable cancer. I think he said it was like a mast cell tumor or something like that on his leg. And he took him to a bunch of different veterinarians, and the vet said, "No, we're not going to do anything. We're not even going to do surgery on it because the dog's just going to die." And he said that wasn't acceptable. So this was a guy that was in IT. He wasn't even a biology or anything like that, but he used all the available tools. He, was able to use Chat GPT to characterize the tumors, used another protein folding technology that was available. He was able to scrape some of the cells off the tumor, have it characterized in a CRISPR lab. There was another company that said, "Sure, we'll make you a vaccine that will go against this particular tumor." And they said, well, of course we'll try it because the dog's going to die anyway. So what do we got to lose? And they created this vaccine against this tumor on this dog. And within 3 weeks, the tumor had shrunk by 75%. Dog was chasing bunnies and hopping over things. And what Jeff was saying, that he said, do you people see what's happening here? He just used
Mhm.
publicly available tools out on the internet to create
Mhm.
something for under $3,000 that would have taken the pharmaceutical industry 12 years and billions of dollars and maybe not even to come up with something as effective. And so
Yeah.
if you can sit in your own home and make therapeutics and follow the guidance that you've given in the book that you say
Yeah.
83% better, and to use all these publicly available things, the pharmaceutical industry and the entire medical healthcare industry, I've said for the longest time, just needs a good swift kick, and it needs to get kicked off off of the cliff and fall to the ground, break a billion pieces. And we need to just pick up the few things like lidocaine and
Yeah.
things that are of value, and the rest of it needs to go away. It's had a good
Yeah.
run, and it's time for
Mhm.
it to stop.
Well, it's hard to argue with results, right? And this is the only reason that my profession continues to exist inside of such a hostile financial and political climate is because more often than not, we get results. And the reason that naturopathic medicine became licensed in Connecticut, of all the places to be licensed, was because in the early 1900s, the governor of Connecticut's wife was saved, I think, from pneumonia, dying from pneumonia by a naturopathic doctor. So it's hard to argue with results. And, again, there's a homeopathic doctor in India, of all places. All he does is homeopathy. He doesn't do hydrotherapy. He doesn't do medical nutrition. He doesn't do botanical medicines. He doesn't do anything else. All he does is homeopathy. And he's got like a 77% success rate with this type of cancer, an 83% success rate with this type of cancer, a 97% rate with this type of cancer. It's remarkably effective. And this is where the money should go. This is where the research should go, but it's not going to go there inside of a monopoly because
Right.
the monopoly will not allow it to happen. Because remember, in the infamous words of John D. Rockefeller, who was one of the architects of the medical monopoly, a patient cured is a customer lost. And
Exactly.
that's not going to go quietly into the night. Big Pharma is not going to go quietly into the night. And that was another of the impetuses for me to write this book. Because look, I've always thought, wouldn't it be great if we could have change from the top down? Right. And there's a constitutional Congress, and we've got medical freedom. And oh my God, I can't believe it. Let's go. That's going to be freaking fantastic if that ever happens. But until that happens, people still have asthma. Their kid still has eczema. They still have croup. They still have rheumatoid arthritis. They still have morbid obesity. They still have Alzheimer's disease. They still have cancer. And these things exist right now today. So what are we going to do right now today? Well, I've got solutions. My colleagues have solutions. People just need to belly on up to this bar and look at the information and, you know, jump in this car and ride it, man. Ride it around the block and see what happens and lean. Don't believe anything that I say.
Well, Peter,
Believe results. Results is what's important.
We got about 2 minutes left, and I want you to tell people where they can get your book and your courses, your online courses, and tell them, in 2 minutes, what your membership is like.
Okay, well, thanks very much, Sherri. So, do you have a link to my stuff yet? Do you know?
I don't think so.
Okay, so there may be a link that you'll be able to put somewhere that people can just click on that and go to my site and become a subscriber. But the website is leavebigpharmabehind.com, and that's got a nice ring to it. And that's also the name of the book. The website and the book parallel each other, except the website, of course, has video tutorials on it. And for my subscribers, I have 108 illnesses that I tell you the MD idea of how it happened and what they do to manage it. I tell you the naturopathic understanding of why it happened and what we do to try to cure it. And then I lay out a self-help health recovery protocol you can employ right now today from the comfort of your own home. I do that for like 103 different illnesses. I tell you about really good, safe, effective naturopathic detoxification therapeutics, of fasting therapeutics, how to kill the parasites. And then I have a whole section on the website called Medical Myth Busting, where I tell you the truth about vaccines. But Sherri does that better. I actually have another section where I interview people. I've interviewed Dr. Tenpenny about the whole vaccine thing. That's there. I tell you this real story about salt, the real story about cholesterol, the real story about blood pressure, the real story about acidity versus alkalinity. Honest to God, the stuff you should have been taught in high school is available on my website. And Sherri's right. I do try to make it funny. I try to make it entertaining. But the goal here, again, is just to teach you what to do to help your body fix itself, because as God is my witness, it can. And you simply do not know what you're missing. So go to the website, become a subscriber. You can subscribe for a week or for a year. Get the book, read about the history, read about the philosophy, and let me show you how, as quickly as possible, to extricate yourself from the conventional medical mousetrap. And I'll give you a guided tour of the undiscovered country by most of science-based, clinically verified naturopathic medicine, and you're going to love it.
Oh, that sounds great, Peter. Dr. Glidden, you are just such a wealth of information. And this book is really something that is a lifetime of study. And,
Mhm.
the things that are on your our website are just amazing. So thank you for being with us here today and sharing all that great information about the history of naturopathic medicine and what it really means to see a naturopathic doctor and what kind of training that they have. And it's really, really important to support this profession because it's going to be the way forward as big pharma falls apart and as we leave big pharma behind, is what Peter's book is. So thank you so much for being with us here today, Peter. I want to thank everybody else that's been with us here today and every day. And with that, I close out with one of my favorite verses from the Bible. I close all my podcasts with, which is easy to remember, and all you guys should have this one memorized by now. It's Romans 12:12. Rejoice in hope, be patient in trouble, and be persistent in prayer. Remember to lean into God, trust Him for everything. He won't let you down. His timeline may not be your timeline, but He's always there with you. So wish everybody have a great rest of your day. We'll see you here tomorrow or the next time on the Tenpenny Files. Have a good evening, rest of your day, everybody. Goodbye and God bless.